Pregnancy is a strange time, don't you think? For 9 long months, a woman's body plays host to a growing little human, which starts off as a couple of cells and then begins to multiply and bud off arms and legs, taking on a more acceptable look. When the time is up, out comes the baby, filling you with a range of powerful emotions, from pure joy to overwhelming disbelief that this baby right here is yours. But today, I want to mention some of the psychological difficulties a mother can experience following the birth of her bundle of joy. Pregnancy is tough on the body. There's going to be stretching of the skin, aching joints, sleepless nights, a big belly which makes moving around that much more difficult. And to top it all off, the moment of birth is a painful and highly emotional process. So it's a no-brainer that mothers will find some parts of their pregnancy and delivery uncomfortable, but no mother wants to be crying, feeling anxious, irritated or sad after they bring home the baby. Unfortunately, this is quite common, with 7 out of 10 mothers experiencing this combination of emotions, which are also known as baby blues. The baby blues tends to occur around the first few days of motherhood, which coincides with the sleepless nights filled with the sounds of a baby crying. Mothers can worry that they are not making their child happy, and that horrible feeling of "am I doing it all wrong?" can leave her anxious and afraid. As stressful as that sounds, the baby blues generally only last up to a week, while the new mother and her new baby get to know each other and begin to settle into a routine. But if such emotions persist for longer, and the mother begins to feel extremely tired, unable to cope, feeling panicky and extremely concerned about their baby, they could be suffering from depression. Around 1 in 10 mothers suffer from postnatal depression, but most keep quiet about their difficulties, possibly due to the pressures of feeling inadequate as a mother and afraid of not feeling the normal emotions of becoming a parent. But there's no need to suffer in silence. Seeing your family doctor about how you're feeling can open doors for really effective treatment, which can include counselling and medications to ensure that you are feeling your very best during the challenging months of early parenthood. Speaking out about the difficulties you're facing, whether it's to your family, friends, or trusted healthcare professionals, will no doubt have benefits all by themselves. Because the worst thing someone who is feeling sad, teary, and on the edge can experience is the feeling of being alone, and that you aren't. There is also a more severe form of postpartum depression, which is stigmatized because of the term used to describe it, and that is postpartum psychosis. The word psychosis is used here to describe the confused and disorientated state someone can be in. If the depression is severe enough, it can cause you to see or hear things that aren't there, which can be an incredibly scary experience, as you can imagine. Going through such tough times, when you are experiencing so much change in your life, having a new baby, a new routine, which can often feel as far from a routine as possible, and dealing with the sleepless nights, high-pressured days, can leave you tired and unable to cope. Unfortunately, self-harm and suicide is a real risk in postpartum depression, and for this reason, I have to urge you to seek help, whether it's for yourself or for someone you know, because the support and treatment is out there and available. But the first and only hurdle to access a happier you is to seek help in coping with the dramatic changes you are going through. Don't be afraid to speak out when you are feeling low and sad, because you aren't alone in this. There are mothers out there who are recognizing that something's just not right, but continue to suffer in silence, and no one should have to go through that. Not when there are ways to make mothers feel happier and feel supported so that they can continue taking such wonderful care of their little bundle of joy.